Varanadi kshayam. Varanadi kshayam, the reference is from Ashtang Hriday, Sutra Sthan, Shodhanadi Gan, 21st number shloka. Here is the shloka. Now let's see what and all composition is there. So there is Varana, Shairyak, Swet, Shatavari, Chitrakam, Morat, Vilva, Vishanika, Brihati, Kantakari, Karanj, Puti Karanj, Chaya and Haritaki. All of these are available in equal parts along with Bahal Pallava, Darva and Bhalagam. All this in equal parts are used in making Varanadi kshayam. If we see overall composition of all the drugs, most of the rasas are Katu, Tikta and Kshayam. Hence the Kshaya is Laghu and Ruksh's nature, the Virya is Ushna and Vipak is Katu. Now what is the dosh karma? So Acharya have mentioned in the shloka itself that Varanadi kshayam is kaf med mandagni niyachari, means it decreases kaf med and works on mandagni also. So these are the major actions of Varanadi kshayam. Now when there comes kaf and vat, so we can use it in Adhyavat or Udustamba, Shirashul, Gulmo and Antavidrati. Now let's go down again. Now what is the dosh karma? So basically it is Kapha-vata shamanam and Kapha-haram. Now what it works on dhatu as? So it is durmedohar, like it decreases the bad meda or the unwanted deposited made in the body, and also atimamsahara. So it is used in any extra growth or granthi that you can see in the body. Now what this does to the agni? So it is deepanam. It has a slight pachan effect but mainly works on dhatva agni. Now because it has slight pachan effect, so whenever you choose to give this kashaya, make sure you do am pachan first and then you recommend the kashaya. If the patient is having too much of ama lakshana, then we will do am pachan and then give. Now what is the other work on mal? Then it is mutra, it increases urine. Now its actions, it is trotoshodhan in nature because the cough causes avarnam to the vat, hence we need to remove cough or the durmed from the strotas, and hence it is trotoshodhan. It also has lekhan and chedan like effect. It scraps away and removes the extra or the made that has been deposited or the cough that has been vikrut. Now it works on both coast level and shakha level. Coast level because it works on Agni Mandya, Shakha level because it works on Dhatva Agni Mandya, Med and Mass, everything. Against, why? This is very good in the disease where Kapha is predominant. Why? Because it has the properties that are against the Manda and Snigdha gun of Kapha. Now let's talk about the Falashruti. So Acharya has given it in Gulma, Shirashul, Abhyantar Vidradi and Adhyavat. But according to our Yukti, we can use it in very many of the diseases. Now if we talk about classical references of Varanadi kshayam, so Acharya Ashtang Hriday have mentioned Varanadi kshayam with Ushak Adi Garna Churna that we use for Lekhan Basti, if you remember. So when this is used internally as an aushad or can be used in Kashaya Basti form in Apakva Vitradi. It is also used in Kafajashmari and Lepa for Kafaj Visarga. So we can see that here the hero is Kapha. So anywhere where you see Kapha and Vata increased or in Prakopa Avastha, you can use this Kashayam. Now some unsaid effects that I figure out as per Vaidya to use this. So we can use it in non-bleeding piles. The piles, definitely make sure there is no bleeding to the patient. If there is bleeding, then there is involvement of pitta and you have to give a pitta shamana chikitsa. But if it is non-bleeding piles, there is little bit of itching and discomfort, then this is one of the kashaya that you can go for. Headache, what kind of headache? If the patient is having recurrent sinusitis, throbbing kind of headache in the frontal region, then this kashaya is one of the best choices for it. You can also give it in fatty liver because it is durmeda and works on dhatva agni. Hence it will digest the extra fat in abdominal lumps anywhere. Non-structural blockages, one of the best use that I have used this kashaya for is for fallopian tube blockages, and my patient have recovered very nicely out of it. So yes, I used it in non-structural blockages. You can also use it in CAD. Now hypothyroidism, because there is Dhatva Agni get mand in hypothyroidism, so you can always use Varanadi kshayam. It works on cough and vat and will increase the Dhatva Agni. Obesity, Durmeda Durmasahara. Dyslipidemia, again Durmeda Durmasahara. PCOS, fibroids, all are made up of kapha vata, and hence you can use it everywhere. If there is too much bleeding, in menstrual bleeding is increased, then make sure that you do the pitta shamana first and then do kapha vata shamana based on the complaint of the patient. Urustamba Ardhyavata, as said, I use it in skin disease very less, but you can use it in kapha pradhana disease where there is dry lesions and there is severe itching in patient. So this can be used, not the first choice, but yes, according to the yukti you can use it. Also you can use it as per your convenience as a Vaidya, where you see kapha vata shamana karma of the kshaya. Now see, we covered everything. Varanadi kapha medo manda agnitva niyachati adhyavatam shirah shulah gulmast anta vidrati. Everything is here and we used it so perfectly in all these diseases. The dose of the kashaya will be 15 ml twice empty stomach. Based on what disease you are using it with, you can choose what drug to use along with. See, like in drugs, in disease like sinusitis, you can use it with Trifala Gugulu. In PCOD, fibroids, you can use it with Kanchanara Gugulu. If you are using it for Urustamba, go for Mora Pachana Chikitsa. So you can use Amruta Gugulu. In skin disease, you can use it with Kaishora Gugulu. It is also Kapha Shamana, so it will help there. You can use it in hypothyroidism also with Kanchanara Gugulu. If you are doing it for non-bleeding piles, then you can use it with Trayantyadi Kwatham. Where you can't use, make sure you're not using it in Pitta Prakopat situation because it contains Bhalatakam. So sometimes it can cause irritation and itching on Pitta Prakruti patients. So make sure you don't use it for them. Do good analysis before you put the kashayam. Also make sure if your patient is having too much bleeding in fibroids, then make sure that you are not using it. First do Pitta Shamanam and then go for Kapha Vata Shamanam in such situations. You can use it in form of Ghrutam also. If you see that Vata is very much predominant and you have to reach to the places where Kashaya can't reach, so you can use Varanadi Ghrutam. It is also as equally effective. You can use it as 1 teaspoon in the morning for Shamana Chikitsa and for Shodhan Chikitsa as per your yukti. Okay, bye.